June 16th Finance Committee meeting. I'm your committee chair, Vince Cox. I represent Pinellas County. I'd like to call this meeting to order. We'll introduce the other board members, starting to the left here, going down, and then Jeff Gow.
Josh Schulman, City of St. Petersburg.
Councilmember Dan Saraki, City of Oldsmar.
Richard Bennett, Commissioner, North Reddington Beach.
Jeff Gow, City of Dunedin.
Thank you all. And now we welcome everyone joining us on Zoom as well. Clarissa, can you tell me if there are any members in the public in the lobby who wish to speak?
There are no public comments in the lobby.
All right, thank you, Clarissa. And now we'll go for our first action item, which is approving the May 19th, 2021 minutes.
I'll move that we approve May 19th, 2021 minutes.
Second.
Okay, we have a second, a motion and a second. All in favor?
Aye.
Okay, next. We have Henry Lukasik, Director of Maintenance, and Al Burns, Director of Procurement, who'll tell us about the exciting subject of towing, filters, radiators, and you have the floor.
Well, good morning.
Good morning.
And what makes it more exciting is I get to present it to you all in person, so good to see everybody.
It's been a long time.
Been a long time. I haven't presented an action item standing up in a long time, so if I'm a little shaky, bear with me here. So to be somewhat efficient here, we've got 3 action items to 3 different contractors, and they're all before for your approval, recommendation for approval, because they are all with the existing contracts are currently set to expire soon, but these are things and services that we use every day over in fleet maintenance. So the first one is towing. So the fleet maintenance outsources towing to a contractor. It's much more efficient for us. A lot of equipment involves specialized training. That will be with Pagan Towing. The next one is known as DOC Dpf Filters, and what that stands for is diesel oxidation catalysts and diesel particulate filters. In short, think of them as like catalytic converters, but for diesel buses. Those are on all of our 2008 to current vehicles, not electric buses, because those have no engines. What we are able to do with these filters is send them off to be cleaned and baked through a very complex process, and we can put them back on the bus and reuse them, and we do that as a normal preventative maintenance item on our buses. The last procurement is remanufactured radiators. So for an ever-shrinking portion of our fleet that still have copper core radiators, we are able to take those off, send them off. They can be rebuilt. They're sent back to us. So it's much more economical than buying new. I say that fleet is shrinking because most radiators today are aluminum, not copper. So they really can't rebuild aluminum radiators. So with that, I will turn it over to my in-person colleague, Director Burns, for a recap of the solicitation process on all of these.
Thank you, Henry.
Good morning, Mr. Chair and board members. Normally, I would say you're a highly motivated procurement director, but I did not have my robust breakfast as I normally do, so please bear with me this morning. First off, before I go over the procurement considerations, I do want to acknowledge my staff that worked hard and tirelessly to get these procurements done. Mr. David Yoder, Purchasing Agent Purchasing Agent 2, and Ms. Edith Randall, Purchasing Agent 1. In regard to the towing, we put it out for solicitation in accordance with all of our policies and rules and regulations, and I'm pleased to inform you that we had robust competition. We received 3 bidders on that. I will let you know that Mr. Lukasik, personally, since this was a new contractor for us, Henry, my counterpart, wanted to make sure that this Pagan Towing could perform the services, and I'm pleased to bring before you, Mr. Chair, that they demonstrated that they have the ability to do the work by actually coming on site, picking up a vehicle. And Henry, you got to visualize that personally. In regard to DOC Dpf Filters, we also have a new contractor that we're going to be awarding that to, and that is Globe Connect LLC out of, I think, Pennsylvania. Once again, since it's a new contractor, and as Henry said, it's a very complex process for the filters, Henry and I, we engaged with that contractor on a phone call to make sure that they could meet all of our requirements. Lastly, remanufactured radiators. We put that out, and once again, we got competition in the form of three contractors. Mr. Chair and committee members, we at Procurement have been working to get all of our contracts coterminous, meaning within a relatively short period of time, where they can all be easily managed from a contracts perspective, and from managed where Henry knows that, hey, I don't have to put this out on the street for the next 3 years or 5 years in some cases. We do this for those reasons, and also we believe that putting these out, we garner soft savings from staff time and potentially from a contractor's perspective. So finally, all three of these action items, fiscal impact, these items have been budgeted and is a part of the approval of the FY21 budget. So all these items have been budgeted for in FY21. Finally, Mr. Chair, once again, the action before you is recommend approval, a 2-year contract with 3 one-year options with Pagan Towing Services and Transport LLC for a total contract amount not to exceed $240,000, and authorize the CEO to exercise the 3 one-year options. Letter B, recommend approval of a 1-year contract with 2 one-year options with Globe Connect LLC for a total contract amount not to exceed $180,000, and authorize the CEO to exercise the 2 one-year options. And finally, C, recommend approval of a 1-year contract with 2 one-year options for remanufactured radiators with Austin & Sons Electric Incorporated for a total contract amount not to exceed $150,000, and authorize the CEO to exercise the 2 one-year options. If you have any questions, Henry and I would be more than happy to answer them. Thank you.
Thank you, Al. Do we have any discussion or questions here of, okay, Josh Schulman?
All right. Thank you, Mr. Chair. Really, the main question I have is regarding the difference in pricing between the different providers for towing service. It's a significant difference, as well as the same thing for the DOC and Dpf Filters. Is there a reason why there's such a discrepancy between the prices?
Well, that's a very good question, Mr. Commissioner Schulman, and what I would tell you is that we noticed the same thing, that there was such a price difference, and that was one of the reasons that Henry and I wanted to make sure that we had the contractor come on site, be able to lift the vehicle. Additionally, Henry makes it perfectly clear to me that, Al, this contractor has to be responsive. And in the conversations with the contractor, responsive in terms of, hey, a vehicle's down and you need to come pick it up. The contractor has assured us that they're able to meet our requirements and will be responsive. Once again, also in regard to the filters, we contacted the contractor, and we said, hey, wanted to make sure that freight was included. There was no misunderstanding on freight. I think currently they're in the process of shipping us containers already. So when we're ready to do an exchange, we have a container that's provided by the contractor. They have a carrier, all of that. So it was thoroughly vetted because my spidey senses, I apologize, I recognized that, and my senses started saying, hey, we need to make sure that they're going to be able to meet all of our requirements. And I wanted to give my counterpart, Mr. Lukasik, that reassurance as well.
And I appreciate that, and certainly coming on site from the towing and demonstrating that they have the capacity to handle that. From a towing perspective, do we have we had instances where we've had multiple vehicles down that needed towing very close intervals to one another, relatively the same amount of time, or they relatively spread out?
Relatively spread out. There are times where maybe 2 go down a day.
Okay.
And we also made sure with the towing contractor that, they had the fleet of their own available in case, 2 or 3 were needed, especially if there was a mechanical issue and then there was an accident or other issues. So they demonstrated that they had the fleet, and as Director Burns stated, I personally witnessed a live demonstration of them picking up one of our electric buses, which represents the most challenging bus to board and transport back.
Well, and thank you for anticipating my question, which was, do they have the fleet or capacity to handle more than one issue at a time? So I appreciate that. No further questions, Mr. Chair.
Thank you. Do we have any more? Okay, Jeff? Go ahead.
Thank you, Chair. Great questions from my colleague. I had the same questions about the spread within the different bid process. My only other question was, within the bidding process, are minority businesses included in that process?
That's an excellent question, Commissioner Gao. Right now, PSTA only has a DBE or minority participation on federally funded procurements. However, Brad, in the sustainability portion for the agency, we are seeking to develop a small business enterprise program. And my counterpart, Mr. Lukasik, he stressed that, hey, he's developed relationships with different contractors that are locally owned, and when we roll that small business program, there will be consideration given to small, locally Pinellas County companies.
Thank you. Let's keep it local.
Yeah.
Thank you. Thank you.
Okay, any more questions, discussion? Do we have a motion?
Mr. Chair, I make a motion to approve.
Second.
Okay, we have a motion and a second. All in favor, say aye. Aye. And that passes unanimously. Thank you, gentlemen, and we appreciate your good work. Thank you. All right, then next we have, our next item is our annual receipt of State of Florida Commission for Transportation Disadvantage Agreements. Our CFO, Debbie Leas, in person, will take us through this recommendation. Good
Thank
morning,
you.
Debbie.
Good morning. It is great to be here this morning in 3D, so this is awesome. To your point, today's action item is really all about accepting money. And PSTA is now completing its 6th year as the Community Transportation Coordinator for Pinellas County, serving our transit-dependent folks here. And each year we bring to the board and to this committee acceptance of grants that relate to providing trips through nonprofit agencies. There's 4 agencies listed in the action item. And this year that grant is worth $627,990. They have 5 years within which to spend it. They usually spend it all within 1 year. We are also asking the committee to authorize Brad, our CEO, to accept the Trips and Equipment Grant, and that's for $3,589,724, and that covers the cost of our passenger trips for eligible TD individuals. Lastly, in your packet is a resolution authorizing Brad, our CEO, to file, submit, accept, and execute all CTD grant applications, agreements, assurances, and other supporting documentations. What I have to report that's a sad note is that in your original package, we had funding in there for innovation and service development grant agreements. And unfortunately, this service, which is used for door-to-door, on-demand, and scheduled transportation services, like our TD late shift, it is no longer going to be funded. The Florida Commission for Transportation Disadvantage administers the program, but it is funded through something called MCORS, which stands for Multi-Use Corridors of Regional Economic Significance. There are 2 Senate bills that are out there that repeals the MCORS funding and hence funding for this program. What we've anticipated, because we've been hearing about it may go away, is in the draft budget that we'll be discussing later today. We have taken out any revenue from this innovative service grant. But we've included monies in the expense side to continue the TD late shift program. This program, I think, is extremely vital to get people to jobs in Pinellas County. And what we've already done over this last month or so in anticipation of this sad news is started reaching out and developing long-term grant solutions as well as some shorter-term grant solutions. Until those are in place, we are willing to take money out of our current revenues that are coming in to fund this program. But the action item today is to actually accept the other money, which is for the not-for-profit transportation providers and for accepting the money for the trips and equipment grant, as well as the resolution allowing Brad to file, execute, et cetera, everything related to these grant agreements. Are there any questions?
Okay, Josh, go ahead, please.
Thank you, Mr. Chair. Debbie, thank you. It's great to see you in person. How does the grant money this year compare to the grant money in prior years?
Great question, and actually on the trips and equipment grant, it is about $57,000 less, a little bit more than that. The other grant funds are consistent to what we've seen in the past. And of course, like I said, we put in a grant application for $1.9 million out of the Innovation and Services grant to cover multiple years, and that will not be coming forward.
And the second question I had was, has the Innovation Services grant impact, is that going through our legislative committee to work its way back up to Tallahassee?
Yes, our legislative committee has had a lot of discussions about this, forecasting this. We have some backup plans, as Debbie was describing, working with FDOT on some alternative funding, but that needs some legislation to happen as well. So I think the legislative agenda for the state moving forward will be a lot related to this transportation disadvantage, because as you noted, like, despite our efforts, all the revenue sources we get from the commission went down either a little bit or a lot. And that also affected, it was statewide, of course. So the paratransit program that Barta led, that our track committee was very positive about, that went from Pinellas over to Moffett and to Tampa, that also is going to be eliminated. And I think they're just going to eliminate that. But that's going to just stop on July 1. But we're going to, as Debbie said, try to keep it going for a while until we can secure other funding.
All right, thank you.
Debbie, I do have one question.
Yes, sir.
And again, now that we anticipate the loss of those TD funds, so we can still operate the late shift by shuffling things around. What else, and I understand what Mr. Miller just said about the trips to Tampa, which really kind of breaks my heart, because we never had it for years and years and years, and when it came, it was like, it was wonderful because of all the services over there. LifeLink, which is for transplant patients, the burn unit, Tampa Gen. But all that being said, what else would be affected for our TD clients that we, are losing this funding right now? I'm happy we're keeping late shift, because it's really important to keep people working, but
Yeah, it actually, other than losing some money, about the $157,000 out of the trips and equipment grant, it's really not affecting anything else. And I know in talking with Barta, they may have some ideas of what they can do to possibly keep that great program that they've just put into place.
Right. Okay. Well, thank you. Thank you so much, and thank you for the good report. Have we any more questions or discussion? Do we have a motion on this action item?
Move approval.
Okay, do we have a second? Jeff Gow seconds. Josh made the motion. All in favor, say aye.
Aye.
Thank you, Debbie.
You're very welcome.
Thank you, Mr. Miller. Okay. We next have the Employee Health Benefits Renewal. with Liz O'Hara and Debbie Leas, and it's large but very important annual set of contracts for PSTA employee health benefits. Liz O'Hara will walk us through this renewal. Good morning, Liz.
Morning. So, as you said, this is very important. Just in case you do not know, we still have 3 plans for our employees. We have our buy-up plan, which is the most expensive plan for the employees. We have the base plan, which has the majority of our employees in it, and it's offered at a lower rate than our buy-up plan. And we, of course, have our high deductible plan that's partnered with the health savings account. The high deductible health plan is currently our second most utilized PSTA plan, and it does provide funding PSTA provides funding each year to those employees' HSA account. So some information to note is our high deductible plan, as I said, is staying steady with education to all of our new hires. One of the things looked at when we go into negotiations is our claims history. We did have some elevated claims the last few months in our buy-up plan, but overall, we have a good coverage ratio, which is another item the insurance carriers are looking for during renewal. And you can see on this slide, in FY 2020, our increase was 4.4%. In FY 2021, this year, it was 4.46%, and I'm happy to say in FY 22, the increase at 5%. All right, we're proposing no increase in our high deductible health plan. The increase would be shared amongst the employees in PSTA in our buy-up and base plans. And this includes no change to our schedule of benefits. This slide is showing you what the employee pays per pay period. It breaks it out in every plan. You can see our current year, what they're currently paying, and the increase for FY 22, what they would be paying. This also shows you in the last column what PSTA puts in the HSA for the employees in the high deductible annually. All preventative visits are still free. We stress that to our employees under any plan. And Cigna, starting 10/1, has agreed to have telehealth through their MD Live provider free of charge to all of our employees. Some of the other healthy incentives that we do to try and keep our employees healthy is the Fitbit program was extended to all of our employees this year. We currently have 200 participants in that program. We do different challenges throughout the year to get them moving and active. We provide up to $3 a day for the employees in the Fitbit program that have an HSA. They can earn $1.50 for 10,000 steps or $1.50 for 30 minutes of activity a day. And again, that goes towards their HSA. When we do the challenges for the other employees not in the HSA, we have prizes like gift cards and different items like that. And this year, we are going to be doing a virtual / on-site open enrollment for education sessions, which the employees really enjoy, high participation in that. We also do different virtual sessions throughout the year on different health topics. We just finished an 8-week Weight is Over program for the employees that taught them everything from how to read nutrition labels to how to exercise properly and how to shop conveniently and healthy at the grocery store, which was really interesting. Last year, we had to cancel our biometric screening for obvious reasons. We are bringing that back this year. Actually, it will be next month for the employees. That allows them to come in, get their health screenings without having to make an appointment with their doctor so that they can know all of their numbers. All of this will help to keep our employees healthy and help our premiums stay low in the future. So we are recommending a renewal with Cigna for our medical, pharmacy, and dental plans, maintaining Superior Vision for our vision plan, Minnesota Life for our life and accidental death and disability. All in, our cost for PSTA is at a not-to-exceed amount of $9.34 million, and that is the action item for today.
Okay, thank you, Liz. And we have any questions, discussion? Josh, you can go ahead, please.
Thank you, Mr. Chair. So forgive me, I'm a walking healthcare question
right there.
at this point. So and many of the questions I've asked in the past, but on the high deductible health plan, what is our current high deductible for individual or family? What is the deductible?
It's 1,500 for a single and 3,000 for a family.
And do we know how much, outside of what we contribute to the HSA, do we know how our employees who are in those plans are participating as well?
Yes, so out of the 143 or so employees we have in the high deductible, about 40% of them do contribute to their HSA themselves. And out of that 40%, I'm very proud to say, about half of that is new hires that have been hired within the last year and a half. So the education is only getting better.
So, and I appreciate that. The concern I've always had, which I'm living now, is that people don't put money into their HSA, and therefore, when they have an injury that is not work-related, so they have to take care of it on their own, they delay treatment till they can switch to a plan that will cover that treatment more completely. But that generally leads to worse health outcomes, right? So, in my case, it would have been, decreased mobility and for the rest of your life. And so encouraging employees to contribute to the HSA, to cover those costs alleviates that concern. So I know we contribute $300 for an employee, and there's a range based on the plan that they're in. Is there, and I don't know if it's possible, but is there any way to have that being a match or a partial match, do we know, versus just a contribution to the plan, so we can encourage additional savings? Because right now, an individual would have to wait 5 years to save up enough money in their HSA to cover their current high deductible.
I'm going to pass that along to the money lady, actually.
Thank you, Liz, for your
You
presentation. Hi, Debbie.
Good morning again. Commissioner Schulman, you always come up with the most interesting, innovative ideas. I love it. I think that's something we can think about and maybe put a cap on it as we look forward. One of the things that we have to be conscious of is that with the high deductible plan, the insurance carriers are not exactly too thrilled if we keep adding too much in from an employer aspect, because it then takes the burden off of the employee from properly shopping and looking at things, so that it becomes, then actually the premiums ultimately go up because they're not paying attention. So I think that's something that we can think about and look at.
Yeah, because obviously it becomes more expensive as an employer if, so like my deductible was $6,800. So, I wrote a check for $5,700 for this. And if I didn't have it, I would have instead delayed 6 months, switched plans to the buy-up plan or something like that, and then had that more covered by, health insurance, which then increases the cost, shifts that cost to the employer in a different way, right? So there is a balance there. It's not just, there are some medical things that have to be taken care of right away, but when we talk about medical choices, my main concern is that employees aren't incentivized in some financial way to wait to get care. And this is something I've said, I'm living it, but this is something I've said for years, is that they're incentivized to go get treatment and take care of themselves right away. So, I understand that it could potentially increase, costs if the employer is contributing more, but ultimately our costs, I would imagine, would be much higher if employees are shifting back and forth between plans based on scheduling or anticipating their, medical needs.
Yeah. Fortunately, we have not seen shifts between the plans. The other thing that kept our costs low this year, traditionally in Florida, our increases are between 7% and 9%. And what we were able to come in at the 5%, because we do see our employees getting the regularly scheduled visits. They are taking care of themselves, so that was very helpful in keeping our costs low. So, we've got Sean from the Garing Group, and he always provides us some great insights as to how we can achieve some of these goals without hurting ourselves on the premium side.
Well, and I will also say, I think, kudos to Cigna and everyone who's worked on keeping the costs contained as they are. A 5% increase is fantastic compared to, right, the producer price index was just up over 6% year over year, reported last month, for last month. Costs across the board are definitely going up, and being less than that is helpful. I just, again, my concern when it comes to the healthcare and health choices is that employees are making sure they're taking care of their health first and foremost, because that ultimately is what drives the cost down. So thank you for that. Thank you, Mr. Chair.
And thank you, Josh. We have no more discussion or
Move
question.
approval?
Okay, we have a motion from Jeff. And a second. We have a motion by Commissioner Gao and a second by Commissioner Saraki. All in favor, say aye. Aye. Thank you all for the presentation. Thank you. And Brad, these also probably go on the consent agenda, right, for the full board?
Yeah, yes.
Yeah, I would say, yeah. Would you guys
Mr.
agree?
Chair, I think we're going to come up with a way that we can get the board members to be part of the Fitbit program, so you can
Oh, good.
enjoy humility like I do when Liz wins every single challenge.
I'll go on it.
Yeah, I'm in.
I'm in.
I don't think we're allowed to give you the $1.50 though.
Oh, that's
That's
fine.
okay.
Yeah.
Can you give us a Fitbit, though?
I'll be 10,000 stuff.
I'll buy the Fitbit. Be part of the.
Yeah, I think we can get you Fitbit.
Yeah, okay, because mine broke. I have a different one. Okay, next up is the procurement, or the approval of the agreement for telephone services. We have Sharon Spellman, Procurement Manager, and Julie Cagliostro, Director of IT, and you guys will walk us through it. Sharon, or Julie, or whoever.
Good morning, Chair Cox and committee members. I'm Julie Cagliostro, Director of Information Technology. This morning, I'm here to present an action item to recommend approval of the purchase of Ring Central Voice over IP telephone services, including installation, implementation, and testing, utilizing the TIPS contract for a 5-year agreement in an amount not to exceed $250,000. So during the pandemic, our communication needs changed dramatically. Most noteworthy was that the customer service representatives wouldn't be able to operate safely from a central location. They were going to need a plan that would allow them to communicate anywhere with any device to accommodate social distancing and teleworking. The 15-year-old phone system in place on the PSTA campus would not support that need. So PSTA chose Ring Central. It's a flexible, cloud-based video voice messaging plan. The service was reliable, and the customer service team seemed very satisfied, and it was going to align with our goal to expand our operations to include the taking of access paratransit reservations. So this action item actually represents the user costs to replace our antiquated hardware system with a Ring Central cloud-based system, not only for the customer service team, but for the organization as well. So the plan aligns very nicely with our sustainability goals in that it provides workforce well-being, in that it doesn't require everybody to be in one central location in order to communicate. It provides environmental sustainability in that we do not need, it significantly reduces the amount of hardware that we need to support a communication system like this. It also has financial sustainability because it's a combined plan that combines voice, video, messaging, all under one umbrella. Provides economic vitality in that it has version control, it's scalable, and it's very flexible, which improves operational and cost efficiency, and also the overall customer experience. And finally, it's resilient. It's accessible from anywhere with an internet connection and across multiple devices. So that's pretty much the summary of the Ring Central plan and the benefits to PSTA. And now I'd like to turn it over to Sharon Spellman for the procurement part. Thank you.
Thank you, Julie.
Good morning, Finance Committee members. My name is Sharon Spellman, and I'm the Procurement Manager here at PSTA. Procurement intends to purchase these items using the Interlocal Purchasing System, otherwise known as TIPS. That is a purchasing cooperative established in 2002 in Texas. Pricing was received under the TIPS contract, and Procurement and IT also did a market research with other vendors, including Zoom, Mitel, and Fuse. We were able to secure better pricing of the TIPS contract under negotiations with Ring Central. So I'm pleased to introduce to you a savings on that negotiation. A responsibility check was performed, and it was determined that Ring Central does have the capacity to perform the work and are therefore eligible for award. Then again, bringing to you, recommending approval of the purchase of Ring Central Voice over IP telephone services, including installation, implementation, and testing, utilizing TIPS contract for a 5-year agreement in an amount not to exceed $250,000. Thank you. Is there any questions?
Okay,
If you will.
Commissioner Shulman.
All right, thank you, Mr. Chair. Who were the other companies that were vetted?
Zoom, Mitel, and Fuse.
Okay. First off, the voice over IP is a great switch and tremendously versatile. For the record, I use Ring Central in my business.
Okay.
And without knowing that we were going to have a pandemic, the ability to automatically look like I was working from the office but be at home through my cell phone worked wonderfully. That being said, having used them for the last 5 years, there's been relatively significant issues on the customer service side with receiving people that know what they're talking about, and not having to wait for like 6 different levels of supervisors to fix issues and address things. And I don't know if that was pandemic necessarily related, but so the question I have is, as part of this contract, do we have a specific point of contact in the customer service area, or are we just calling the random number to reach help if we need it?
Well, that's a twofold answer. The first part of it is we have a direct representative that we deal with whenever we have a problem that cannot be satisfied immediately through their customer service channels. Additionally, our staff, my staff in the department, has gone through extensive training. So we're actually the first line of support for our customer base. And then our team actually deals directly with the Ring Central team if anything escalates beyond our knowledge base. So we've found that we are very supported and the system is running very well for us. We have not received significant complaints, because we do have ups and downs, but it seems to be running very smoothly, and our rep is very responsive.
Okay, so, and that's good to hear that from a training perspective, most of the operational issues that most of the users would experience would be handled in-house by your department versus having to be, going to the call center.
Oh, yes.
So I think that helps alleviate things. It also means I know who to go to when I'm having trouble with my system. We will come over here to PSTA. So I appreciate that. Thank you. No other questions.
Thank you, Josh. Commissioner Gao?
Thank you, Chair. Just wanted to understand a little bit, and it may not even be relevant, but how does the system interact with PSTA's emergency procedures as far as storm events, tornadoes, things of that nature? Is there any concern?
Actually, I'm glad you asked that question, because PSC has struggled with communication during events where we are not having our staff base located in the building. And this is going to free us from that. This communication was actually originally established as a hurricane preparedness plan. We were using one line because we can call, hundreds of people into one phone line and direct them through menus to specifically communicate during any kind of emergency that limits or precludes our access from this building. Most importantly, the Ring Central plan, and that's why we chose it. And if you notice, we said we vetted Fuse, Zoom, and Mitel. Many telephone communication systems require working infrastructure in your building to function. Ring Central does not. So during a hurricane, if the building suffered a flood or anything like that, our Ring Central communication would still function. So it's very aligned with our goals to be able to communicate in many different ways during an emergency.
Very good, thank you. That's all.
Thank you, Commissioner Gao. If we have no more discussion or questions, do I have a motion to?
I'd move that we approve the Ring Central telephone services for an amount not to exceed $250,000.
Okay. We have a second?
A second.
Okay, we have a motion by Mr. Bennett, second by Commissioner Gao. All in favor, say aye. Aye.
Thank
Thank
you.
you, Sharon. Thank you, Julie.
Thank you very much.
Okay, now finally, we have a really great program, according to my script, to help recommend, I won't believe you, it's to waive our PSTA vehicle donation policy so the PSTA's leadership, PSTA program members, can use a decommissioned bus as a mobile food bank, which I think is a wonderful idea. With us today to talk about this great project are the 2021 class members of Leadership PSTA, Sharon Spellman, PSTA's Procurement Manager, and Safety, Security, and Training Supervisor, Charles King. And of course, we have a highly motivated Al Burns. And Al, let's start it off. Thank you.
Good morning again, Commissioner Al Burns, your highly motivated Procurement Director. I'm really excited about bringing this action item before you this morning. This is for the Leadership PSTA class, and this is a formality, but I just couldn't be more proud to have one of my staff members part of the Leadership PSTA team and be able to present to you this morning. So I wanted to give people that don't normally have an opportunity to present before you that opportunity this morning. The formal part of this is the action is recommend approval to waive the PSTA vehicle donation policy for a one-time donation of a 2007 Gillig to Reach St. Pete. So with that formality, I'll turn it over to the leadership class of PSTA 2021.
Thank you. Good morning again, committee members. My name is Sharon Spellman. I'm the Procurement Manager here at PSTA, and I am joined today by Mr. Charles King, my colleague, who's a Safety and Security Manager, Training Supervisor. Apologize. Each year, 6 high-performing employees across PSTA are inducted into the leadership program. Charles and I are here today on behalf of our leadership class to request a waiver of the PSTA vehicle donation policy. I'll hand it over to Charles now to explain a little bit about why we are bringing this request to you today.
Thank you, Sharon. Good morning, Finance Committee. As you may know, the Leadership PSTA class worked together on a community impact project where we assess where there are needs to provide innovative solutions to make a positive difference in our community. We are in the beginning stages of expanding our partnership with Feeding Tampa Bay and working towards our big idea of a mobile food market. As you can see on this picture here, as we went through our research and stuff, we found that it was done in St. Louis successfully, and we like to donate one of our used buses to create a mobile food market for the community. We have connected with a local organization named Reach St. Pete, who focuses on work to prevent, alleviate homelessness, low-income, and at-risk situations by bridging the gap between people and resources, not only here in St. Petersburg, but throughout the county. Reach St. Pete has expressed that they not only have interest, but the resources needed to renovate, decorate, fill with food, and operate the mobile food market, which we believe would allow this project to live past our year in Leadership PSTA.
So as Charles mentioned, we are in the beginning stages of our program, and we are seeking to waive the PSTA vehicle donation policy. The current policy states that vehicles above 2,000 and below 5,000 require us to contract all interested nonprofits before we can actually donate. The bus we are choosing to donate is 14 years old and has exceeded its value at auction. We would love your approval to keep our community impact project moving forward, and therefore are asking approval to waive the PSTA vehicle donation policy for a one-time donation of a 2007 Gillig bus to Reach St. Pete. Thank you.
Any questions?
Thank you. And we have questions. Commissioner Soraki.
Thank you, Mr. Chair. In the picture, it shows the bus is wrapped. Do you plan on wrapping it like that?
They actually have, they're gonna wrap it. They're gonna do all the work to it. They just want us to like gut the bus, take all the seats and stuff out of it, but after that, they're gonna take care of everything else for it.
Okay, you were gonna do that? I'm sorry.
No, Reach St. Pete will do that.
Oh, okay,
Yeah.
okay. So then the bus will be wrapped after, and then you'll reconstruct it to have shelves for food?
Yes.
Yeah.
I think it's a great idea. I think it's wonderful. Thank you, Mr. Chair.
Thank you. I believe Commissioner Gao, you were next. Go ahead.
Thank you, Chair. I agree, I can't be any more in support of this. This is just fabulous. Is this the first time PSTA has done anything like this?
Yes, so in the past, we have used the vehicle donation policy to donate vehicles and buses. We did that last in 2012 with Park and Goodwill, and we also donated buses to the police and fire departments. So this, as far as the mobile food market, we have not done this before, but we have done donation of vehicles or buses.
And is this a new project for Reach St. Pete? Is this something new for them, or they've done this in the past?
That I don't know if they've done in the past. It's a new project, a partnership with us and Reach St. Pete. We really have not worked out all the details with our relationship with them yet, but this is going to further our relationship also with Feeding Tampa Bay. So with our leadership class, we didn't want to start a new project that we couldn't carry on what the past classes have done.
Mm-hmm.
So in leading the Feeding Tampa Bay March, we thought this was a great partnership to move forward, to also incorporate that partnership.
So it's possible that we might see in the future an additional bus being donated to another organization, continuing with Feeding Tampa Bay in some aspect.
Yes, that is possible.
We could, yes.
Very good. I like it. Wish it much success.
And Commissioner Schulman?
Thank you, Mr. Chair. We have more questions about $4,200 than the $9.34 million on health insurance. But, so aside from that, the question I have, so you said that buses were donated in the past to different agencies. Was that through a solicitation letting them know that we had buses available, or was that through a similar kind of arrangement where we identified a need and went to them? How did that work in the past?
Commissioner Schulman, I can't speak directly to what happened in 2012, but I can tell you what our process is currently. We would post that on our website, just as we post other public notices through the procurement, to let people know and give everyone the opportunity to be able to say, hey, we would like to have that vehicle. That's the way that my staff would handle that currently. But what happened in 2012, I can't tell you, to be perfectly honest.
Okay, and I appreciate that. So, is this the only bus that we have that is fully depreciated that would be going through this sort of process?
We have frequently throughout the year, the procurement staff, disposals falls under the procurement. We auction off vehicles. This isn't the only vehicle that is ready for disposal, but this vehicle right here, because it is in such a state and the value has been fully depreciated, that we felt that it was a good fit to meet the requirements for this program.
And I appreciate that. And really, my main concern is making sure that, while I think this is a fantastic idea, is that other nonprofits don't feel like they didn't have an opportunity, because this is coming from an internal program, that they didn't have an opportunity to get a resource that they may have needed to fuel one of their projects. The last point that I have is, has there been any thought about, as part of the wrap or decoration on the bus, attributing the donation of the bus to PSTA, so that the community is aware that, on an ongoing basis, this is a bit of a partnership as well.
So, sorry, as I explained earlier, we are in the beginning stages. We would like to incorporate other organizations within the county to participate in this bus. But that's future and down the road, and we are looking at possibility of things like a children's association painting the outside of the bus, having a PSTA sticker on that bus so that they are aware that it came from PSTA. Also partnering with maybe the St. Pete Youth Farm so that they could also put food on the bus. So Right now, the project is just to get the mobile food market up and running. But yes, in the future, we are looking to expand those relationships across the county.
And I think it's wonderful, I think it's needed. I appreciate the work that you and the whole PSTA leadership class have done on it. You know, I would be in favor of waiving the policy. Thank you.
Go ahead, Commissioner Sracky.
Last question, if the board approves this, what's the plan for future maintenance?
That is not going to be handled by PSTA. That will be handled by Reach St. Pete.
Perfect, thank you. Excellent.
Okay, thank you. And I have a comment or two here. Reach St. Pete is, they're based out of 5501 31st Street South, which is the Pinellas Community Church. And they have a very vibrant program right now on Tuesdays where they have a food giveaway. And I mean, it's big. It was much larger even before or it was large before the pandemic too. This isn't like a startup. They've been around for a while. It's in my neighborhood, so I'm very familiar with it. So I think it's a great partnership. I would have would the bus be, it would essentially be theirs, is that correct? And they'd have their own driver and so on and so forth.
Yes.
Okay, good. I think it's a wonderful idea. And if we have a motion on this, we'll go ahead.
Mr. Chair, I make a motion to approve.
Second.
Okay, we have a motion, a second. All in favor, say aye.
Aye.
Thank you very much.
Thank you very much.
A wonderful project. Good job. And, committee, do you think most of these we could put on the consent agenda for the board? But I'd like the board to hear this, about.
That was our thought as well, yeah.
Hey, look, we think
To have him hear this, yeah.
all right, cool.
Yeah.
Next, we'll move on quickly because we have a hearing at 10, am I correct?
Yeah.
Okay, the monthly financial report. Julie Lupus, will you walk us through the financial report? He's still alive and well.
It is, I'm going to echo what everyone else has said. It is very, very odd to be here in person with everybody, and it's a wonderful opportunity, so I'm glad we're all getting back to normal a bit. It's very nice to see you all. So I'm Julie Lupus, Director of Accounting. I know we've done this on Zoom numerous times in pre-pandemic, but in April, we finished .53 million unfavorable to budget, which was driven by the reduced passenger fare revenue. Staff has also continued to work on controlling expenses, coming in at $380,000 favorable to budget. The effects of COVID-19 on purchase transportation services has been a factor in this favorable budget. For April year-to-date, we not only have a surplus, but are exceeding budgeted expectations by 11.34%, or $2.7 million. Expense control and lingering COVID-19 effects are carrying this surplus, with salary and fringes under budget $1.3 million, and purchase transportation services under budget, coincidentally, $1.3 million also. And that's what I've got for April, and if anyone has any questions, I'd love to hear them.
We have no questions from the committee.
I was being concise because of timeliness.
That's it. Thank you.
No problem.
Okay.
Have a nice day.
Thank you, Julie. And now, Brad, do you have anything on ridership performance for us?
It's in front of you.
Thank you.
And I'll just highlight that ridership is bouncing back quite significantly throughout the spring. It's not back to where it was in 2019 yet, but we're doing a little bit better. I spent some time with some of my other Florida transit colleagues, and I think because of our more tourist-oriented services, we're kind of coming back to normal a little bit faster than the others. But happy to answer questions about that as well. It'll be interesting to see once we restore fares,
Right.
what that does, if that has a negative impact on ridership.
Okay, thank you. And Brad, just a quick question that we're actually launching our new paratransit on July 1st, am I correct? And how are we doing with that? So far, how's it going? The whole
So-
overview of it.
So far, so good. The transition, of course, is fairly complex, as almost every single employee of Care Ride is being hired by either First Transit or the taxi. They're switching employers.
Right.
And some of those employees are taking a little time off in the middle before July 1. So Care Ride is losing a lot of employees right now. They're barely hanging on, but it's okay. I told Tom Tibbetts, he's only got 14 more days that he's got to survive. And then the taxi has come to the rescue. They've already started providing some trips, and that's ramping up. First Transit is providing some trips as well. Thank you very much for approving Ring Central, because that is now, I think it's as of Monday, PSTA is getting all the calls now coming in through Ring Central to this one number, and then we dispatch them out to Care Ride still, and to Bay Area Metro. So lots of activity going on. I think, on-time performance has taken a little bit of a dip. I mean, it was at high 97, 98%, and it's down to the low 90s, which is really not that bad. But we're making it, and we're just going to survive. It'll get much better after July 1.
And that's to be expected when
Yeah.
you're making a major transition such as this. How about the partnership with USERV and First Transit? Have you heard any feedback on that?
So far, so good. I mean, the user is providing trips. They've hired more than 200 people in Pinellas County,
Wow.
supposedly.
Yeah.
They've got their vehicles. First Transit has gotten their new vans in.
Right.
They got the PSTA logo on the side, which is Commissioner Schulman has been asking for a long time instead of. Yeah. I saw some pictures of that yesterday. So.
Okay, good. I mean, that's all positive, and thank you for informing us on this. And do we have any other business in front of this committee? And if not, we'll adjourn. Thank you. Next.
We'll do about 5 or 10 minutes, Vu? Okay.
We're gonna you do this, right?
Yeah.
Can you do it okay with your arm?
See you.
Great.
That's like on Perry Mason, that's how they do it. Perry Mason, he uses a pen.
Well, tungsten carbide, it's